do you think it's possible to be eligible for care and still be discriminated against when you try to access health care?
No one is discriminated against at the VA, and by simply repeating that could keep somebody from getting the critical mental health care that they need, and that would be on you and anybody else that wants to repeat it.
Well, Mr. Secretary, in fact, many of us have heard from women veterans.
Then did you help correct them?
Mr. Secretary.
Did you help correct them?
Mr.
Or did you provide the line?
Did you? You took the words
I did.
I
I've
did
been
not.
on TV. I've been on TV. I put out videos. I've done everything because of a false article. I cannot believe we're still going down this route.
Well, I can believe
It's amazing.
I can believe it when you take words out that people hear them in a and I'm telling you that, Mr. Secretary. I'm simply telling you when you took those words out, people heard it in a specific way. Therefore, I'm asking you, why don't you put them back in and
No,
eliminate
they
this?
heard it in a specific way
Well, we
because
disagree.
a reporter who looked for clicks decided to write an article that he knew was false.
Again, I have heard from women veterans about experiences, which is why I have.
Do you have an example that you can give to me? Because I'll make sure it's corrected. Nobody is to be discriminated
If you're
against.
going to call each individual woman in the country and tell them they're not going to be
There's
discriminated.
not every woman in the country that's done this because, number one,
Well,
we
let
only
me
serve
move
veterans.
on. Let me move.
Sent you a letter February 13th, a number of members of the Appropriations Committee asking some basic questions about DOGE engagement with the VA. At 13 specific oversight questions. You and I then spoke on May 6th. So we hadn't gotten any kind of meaningful response. You committed to get me meaningful responses. Still have not gotten responses to these questions. And I think this is an opportunity to bring transparency to an issue about which there's been a lot of public controversy and concern. So I haven't gotten answers to these questions that I asked and a number of members asked in February. So I want to ask you now, which DOGE personnel have visited VA facilities?
I don't understand the question.
Okay, which DOGE personnel?
Okay.
So personnel who are acting under the auspices or authority of the Department of Government Efficiency have visited, let's start with VA headquarters.
Are you talking about our liaisons who actually work for the VA?
I'm asking,
We have 3.
I'm asking which DOGE personnel have visited VA headquarters.
The ones that work for us.
Okay, what are their positions?
They're advisors. They're looking at through our contracts and stuff like that.
Okay, are they still doing that?
Yes.
Okay. Have they accessed VA patient medical records?
They are acting in their role as employees as a normal VA employee would do, and are authorized to do anything that they're currently doing.
So,
And I'll be happy to take these further for the record if you like.
well, Mr. Secretary, I asked you these questions on February 13th in a letter.
Okay.
It's the end of June. I mean, you were a member of Congress. Would that be satisfactory to you?
If I'm offering you a solution, yes.
Well, we spoke in
And
May.
I'm offering you a
said-
solution.
No, come on, Mr. Secretary. I asked you these questions in February. We spoke in May. You said you get me the answers, and here you're saying you'll take
And
them
in
for
all
the record.
fairness, you just asked me a question about who DOGE employees walked into my facility.
A question
Don't tell
I
me you're
first
trying
asked-
to be
a question I
trying to be
first
serious
asked you
about
in
this. I mean, what DOGE employees? I mean,
No, what I just
yeah.
asked you was,
Mr. Chairman,
what I just asked you is, have DOGE personnel access
I'll be
to
happy to
medical records of veterans?
and
in
I
the
have
VA
told you
database?
that I told you they're acting in the roles under everything that
There
they're
would be a
supposed to as
lot
VA.
less concern about this if the answers weren't so cagey on it all.
There's no caginess to it. Any VA employee who has access to anything and work at the VA is totally responsible and trained
Let's
to do
work
what they
together,
do.
Mr. Chairman, to get some clarity on this, because I'm not satisfied. It's been months. I don't know why there is such a lack of willingness to engage on this topic. We will follow up, Mr. Secretary.
Thank you, Mr. Speaker.
Mr. Secretary, EHR deployment has been a complex endeavor. You now plan to deploy it across 13 facilities next year, including 4 in Michigan. And all this will happen during a planned downsizing of VA's workforce. How will you ensure that outages, slowdowns, and disruptions to veterans care will not occur once again under this new EHR deployment plan?
Thanks, Senator, and I'm glad to have your state being the tip of the spear on this reorganization. If you would allow me, and I'll try to do this very quickly, I've been said that I talk fast, but let me talk real fast here. What happened when I got there was I took a complete shutdown of this program. The previous administration, for whatever reason, I'll leave it with them, it just shut down the system and they were not moving forward. When I came in, I promised the committee when I was confirmed that this will be something we were going to look at. So really what I did was, in my first week, I took our staff that were working on this. Dr. Neil, has been the head of it for a long time. We sat them down. I said, okay, what's the problems? The next day, I brought in Oracle, who is handling the implementation here. And I sat down, okay, so what's the problems? Where we can do this? There was differences of opinion. The next week, I sat them both down, basically had a match in which they went at each other, complaining because they never were talking directly to each other. After that meeting, I said, we're going to start standardization. We're going to look at other things to make this clear. We had I believe it was 8 committees on our side that everybody had to go through to get approval to do a standardization or something dealing with the health records, which caused delays, caused cost overruns, and caused what we saw in Washington State, in which we have 6 facilities that are basically not functional, okay? They then got in a room, and this is our professionals, our careers, and Oracle's folks, and they got in a room for 2 days, and they spent nothing but how do we do this and how do we plan. And what happened was we come back from our position and says, like, standardization, we're going to take the Oracle standardization for coding and those kind of things, and we had about a 10% gap to where VA would have our uniqueness, which we have that other hospitals don't. What they came up with, not I or anybody else, but this committee and this group of high level from Oracle and from us said, is here's what we can add. That's how this is going to go about. That's why the funding for this is so vitally important, because I can't emphasize enough, if we do not transform this system, it hurts our community care process because our doctors cannot communicate with the community. Our doctors internally, if we go back to what Senator Baldwin and I were talking about retention, you're using a system that's costing us literally hundreds of millions of dollars that's used nowhere else in the world except the VA. So we need to move forward on this. I do believe we have a path that is safe, that is effective, and will be cost effective because Oracle understands that they've got to provide this. They're now in the position of a vendor again and not anything else. So I apologize for the longer answer, but I need you to hear it.
I would just add one comment about the recruitment and retention of physicians and nurses. I've heard from a lot of the practitioners in VA practitioners in my state that when they begin to be doing the jobs of several others who have been dismissed, nurses doing the work of CNAs, and if they want to start an IV, having to also do the logistics of getting the IV pole and the IV.
Right.
They're doing the work of several people beyond the additional overtime implications of their job. And so working conditions as well as salaries need to be looked at. You don't have to comment.
No, I
just wanted you to hear that.
And I appreciate
from me.
that, Senator. But I need to comment because it's not been let go. We're not firing anyone. So, I mean, for them to say
You're firing the people underneath. who
no, we're not
support
firing
them.
anybody. I mean, it's not from RIF. It's not. If they're being fired for a cause issue in the facility they're at.
They were let go, and I'm talking to the nurses.
But they're not from things that we've done.
Since you started.
No, I mean, tell me where they were because it's not happening. I mean, the RIF was.
Be
the
happy
RIF
to
has been
follow up
stopped.
with you with the examples.
If they've taken early retirement, that's not firing.
They're not there, and so you have to
Okay,
face that in order to keep your nurses and doctors
Senator, I'll be
who
happy to
aren't
work
being
with you.
supported.
I'll be happy to work with you, but there's no one being fired. They may have left for other reasons, but they're not being fired.